Okay, so this is the third part of the sexual self, and we are going to discuss different sexually transmitted diseases. So, this STDs, or also known as STIs, sexually transmitted infections, okay, are transmitted from an infected person to an infected person through sexual contact. Okay, so they might be caused by bacteria, viruses, or parasites. Now we are going to discuss some of the most common STDs or STIs. Okay, so the first one we have chlamydia, which is caused by Chlamydia trachomatis. So this kind of STD could affect, okay, the cervix, okay, or the female genitalia, the rectum, the throat, and the urethra. Okay, for women, the symptoms of chlamydia might include abnormal vaginal discharge with strong smell. Okay, so as I have told you before, there are normal discharge among women. And how will you know if it is abnormal? It has a strong smell. Okay. There is also a burning sensation when urinating and pain during sexual intercourse. Okay. For male, there might be a discharge from the penis. It might look like pus, or it might be pus itself. Okay. And there is a burning sensation when urinating, burning or itching around the penis, and it is painful and it is swollen. Okay. For gonorrhea, in Tagalog, this is tulo. Okay, so it can affect the genitals, the rectum, and the throat. For men, the symptoms is it could be a burning sensation when urinating, white, yellow, or green discharge, and it is painful. The testicles are painful or swollen. Okay, so tulo for women includes burning sensation when urinating, increased vaginal discharge, and vaginal bleeding between periods. So even though you don't have your monthly period or your menstruation, there is spotting or bleeding. For rectal infection, so most probably this is caused by anal sexual intercourse from the person who is infected. So there might be discharge coming from the anus. Okay, anal itching, there is soreness, bleeding, and painful bowel movements. Okay. Next, we have syphilis. So, this is caused by Treponema pallidum. There are actually three clinical stages of syphilis. Okay, so we have primary, secondary, and tertiary. So, if it is primary syphilis, there might be a formation of a painless ulcer, and this is known as the chancre. So, this chancre will last about for 3 to 6 weeks. Now, if the person was untreated for this period, okay, it might lead to secondary syphilis. Okay, and during this time, there might be appearance of skin rashes on the palms, okay, and then the soles of the feet, but these rashes typically do not itch. So there might also be appearance of patches. Colors are grayish or whitish, and this is known as the condyloma. So this is already a sign that the infection spread out through your body, and there are other additional symptoms like fever, enlarged lymph nodes, fatigue, weight loss, hair loss, headaches, and muscle aches. Now, if the person has been treated or untreated, but the symptoms already stop, okay, the problem might still reoccur after 10 to 20 years, and this is known as the tertiary syphilis. Okay, so it can already cause damage to the organ system, and it could be fatal. It might cause death to a person because the damage is already in the brain, the nerves, the eyes, heart, blood vessels, livers, joints, and bones. Okay, so remember, it might occur, okay, 10 to 20 years after the initial infection of syphilis. Okay, so we also have neonatal or congenital syphilis. So if it remain untreated, so this is for women who are pregnant. Okay, and the infection might be transferred to the fetus or to the baby inside the womb, and it might cause death to the fetus.